So what happens after your loved one dies while on hospice? In this video, I'm going to discuss what happens at the time of death, what happens with postmortem care, who we call, what do we do, what things do you need to know, and then what happens after your loved one leaves the house. So there's two types of deaths that I usually see on hospice. One, and the most common one, is the gradual progression. Everyone kind of knows it's happening. We're prepared. You see this slow decline until they're actively dying. Then the other side is when it happens suddenly. They're on hospice, you know they're dying. You were thinking it was going to be this progression, but then suddenly you wake up and they're gone. That does happen on hospice sometimes. It even surprises us as hospice workers. Two different scenarios, the same thing happens, but I think over here when they die suddenly, it can feel a little more hectic. Okay, so what happens? In either scenario, with this scenario where it's taking the normal progression, usually the nurse and the hospice company knows it's coming, so they'll be visiting kind of every day just to check in on you guys and make sure everything's planned. Now, when it's the sudden one, hopefully it's already been planned as far as like what you want for mortuary plans and who you're supposed to call, but if not, we'll take care of that too as a hospice company. What do you do when you notice that your loved one has died? Now, specifically on hospice, just to be very, very clear in this video, I'm specifically talking about patients already on hospice. If they're already on hospice and you notice they have died or you think they have died, you call us. You call your hospice company. Now, technically, depending on the state you live in, the hospice nurse does not have to come out to declare them dead. They usually will, but just so you know, some families are really prepared and they've gone through this before. They know what to do. If you live in a state where you don't technically need a healthcare worker to declare someone dead, you don't need them to come out. But I would say 9 times out of 10, the nurse will come out and declare your loved one dead and give them a time of death. So how does a nurse declare someone dead? Technically, we have to listen for their heartbeat and check for respirations for 2 minutes. So when I go to a death visit, we call them, I would do that first, just to make sure the person has died. And I will give them the time of death once I declare that, and then of course talk to the family. The big thing that will help all of this go so much more smooth is if you already have a mortuary in place. So if you are watching this video and you don't have mortuary plans in place, or what you'd like to happen if you died, you need to do that. I feel like everyone should have this plan. Me, you, especially if you're on hospice. So hopefully the family has already made these plans. What mortuary to call? Does the person want to be cremated? Burial? Is there a plot? All these things should be figured out before this happens. If that has been done, the hospice nurse, myself, will ask the family, what mortuary did you have in mind, or what numbers should I call, because they should have a number already. And then I'll call the mortuary and let them know what's going on. I'll give them the time of death. They usually want the height and the weight. They'll want an address, a phone number of a family member to call, and then of course the doctor who will sign the death certificate. And a side note about the death certificate, always try to order several death certificates. You'd be surprised how many different entities want the original death certificate. So just a tip, always get several death certificates if you can. Now let's say this was a sudden thing. Even though they were on hospice, they still weren't ready to figure out mortuary plans, which happens a lot. I will still be there, the hospice nurse would still be there declaring your loved one as dead, but you don't have any mortuary plans in place. Now what? It's okay. It's not ideal, but we will sit there and help you figure that out. Figure out which mortuary to go with, which cremation place to go with, depending on what your loved one wanted. Now, it does make for a more hectic scenario because now you're trying to figure it out last minute. And unfortunately, sometimes it can be more expensive too when it's last minute, but we will sit there and help you figure that out. One big takeaway from this video is that the more prepared you are, the better and smoother this will go. It's already gonna feel hard and chaotic at times. You're grieving, your head's going to be in the clouds. So the more prepared you are for this moment, the better and smoother this will go. Another tip is to give the mortuary the hospice number. We are dealing with this kind of thing day in and day out, so we know the information that each other needs. And sometimes the families don't know the information they need. So if they start having questions that you can't answer, always give them the hospice number, and hopefully the hospice can usually answer those questions for you. Once the mortuary is called, it usually takes anywhere from like 90 minutes to 3 hours for the mortuary to come and take your loved one. It does depend on what city you're in and traffic and all types of things. I know I live in Los Angeles, and it definitely takes at least 90 minutes for the mortuary to get there and take your loved one. It could be different from city to city, state to state, but know the time. You should know when the mortuary plans on being there, because some people want their loved one to stay in the home for hours waiting for everyone to come in from out of town. Some people would wish them to be picked up sooner. So it just depends. So you got to talk to your mortuary and see how they work. I would say it's usually anywhere from, like I said, 90 minutes to a few hours. If you do want your loved one to be in the home with you for longer, tell that to the mortuary so they can hold off picking them up. I will say though, there are laws varying from state to state how long your loved one can be in the home. Like you can't just have someone in your home who has died for 24, 48 hours. You have to eventually pick them up, and there are different laws depending on different states. After I speak to the mortuary, what I usually do as the hospice nurse is talk to the family about next steps. Some people want to provide postmortem care to their loved one. I usually look at the person who has died. If they haven't soiled themselves, which not everyone does, I think that's a big myth. A lot of people think like once you die, you have a bowel movement and urinate. That does happen from time to time and they need cleaned up, but that doesn't happen all the time. So a lot of times if the person looks good in bed, they look comfortable, they're laying there flat, they look nice, I will just leave them as is. If they do have like a Foley catheter or any kind of IV, I usually will take that out for the mortuary. And if the family wants to do postmortem care with me, I will allow that. The one thing I will say is it's actually pretty difficult to move someone who has died. They're usually very, very heavy. So doing postmortem care alone can be very difficult. So a lot of times if family wants to have postmortem care, meaning the person cleaned and changed and repositioned in bed, if I am the only hospice nurse that is there, it'll be almost impossible for me to do it alone. So I will tell that to the family and I'll say, I'm happy to do this, but you may need to help me. Is that going to be okay? Most people are okay with that. Some people say no. And then we just do the best we can to make them look presentable in bed. Different religions will want to do different things with their loved one's body. I will always ask specifically, or at least try to know even beforehand, what religion the family and the patient was, and if they have anything specific or special that we should or should not do with the body. A lot of families would like their loved ones' eyes and mouths closed because, like I've been telling you guys, this is a common thing at the end of life, even before someone dies. Their eyes will be open and their mouths will be hanging open. After they have died, that will continue. Their mouth will be open and their eyes will be open. If I can, I will try to close a person's eyes. It is very difficult to close the person's mouth and keep it closed. You can always put a towel underneath the chin to try to close the mouth, or a scarf around the head. I particularly don't like that. I usually just try to educate the family about how normal it is for this to be happening and why it's happening. It's because the muscles are really relaxed. But if they still insist, of course, I will do my best to close the mouth and the eyes. Also, while I'm waiting for the mortuary, I will talk to the family about how to dispose of all this medication they have now. Unfortunately, hospice nurses are not allowed to take the medication. This is their property now. So what can they do with it? There's a few things. One, you can take it to a pharmacy, usually the one they've been working with, and there's usually a disposal area where you can dispose of these medications. If you don't want to do that, because that is a lot of work sometimes, or sometimes the pharmacy doesn't have that, you do what we call destroy the medication. So you want to have a witnessing you destroy it, and that means usually putting all the medication in a trash bag, covering it with dish soap or detergent, and that's destroying the medication, and then you would throw it out. You never, ever, ever, ever throw it down or flush it down the toilet or rinse it down in the sink. You never want to put it into the public water system. The second thing I talk about with the family is supplies. Families always want to know, what am I supposed to do with all of this supplies now? Meaning gloves, briefs, bed pads, lotions. A lot of them are unopened and unused. Unfortunately, we are not allowed to take those back. So what do you do with them? One, you can keep them because they can be used at another time. Two, some thrift stores will take them, or like churches will take them so they can give them out to other people in need. I would just ask around in your community about who may need and want these, because they are really expensive and really wonderful things that the community may need. So fortunately, we can't take them. I usually just tell the family to ask around in their community who may need them. And a lot of times, like I said, thrift stores, Goodwill, Salvation Army, sometimes they will take those things. Lastly, the DME, which is medical equipment. So the hospital bed, the oxygen, wheelchairs, what's gonna happen with those things? The DME company will come pick those up in a day or so. I feel like that's always a hard time too, because that really makes it real for the families, right? Their loved one is now gone. The equipment is still there. And then in a couple of days, the DME company will come and pick it up, which can be a hard day, but that is what will happen with the equipment. There are certain equipment that the DME will not take, like the bedside commode. I don't believe they take walkers. So there's certain things that you will still have at your house. Again, once you have those things, they are yours. You can save them and use them for other family members, or try to find someone else who may need them. And lastly, and the most important thing, is to know this. Just because your loved one has died does not mean hospice stops. We still have a full year of bereavement services for you and the rest of the family. So please, please, please take advantage of that. I think a lot of people will take some time and they are reluctant to use the services that are available to them. But I implore you to please use this service. It goes unused so often. So for up to a year after your loved one dies, there are bereavement services offered to you through your hospice company. Please ask about that. Each hospice company will provide different bereavement services, but the two main ones I see are support groups or even one-to-one counseling. I think both of these things seem intimidating, but to me, what I have witnessed is those are the most helpful, especially support groups. People deny support groups all the time, but I feel like we really can heal in community. So please ask your hospice company how they provide bereavement to the family.